As summer is quickly winding down for kids across Missouri, it is time to start getting ready to head back to school. While you're checking off the school supply list, it's also important to check your child's vaccination status. ABC 17's Gabrielle Tyner has a look at what you need to know before sending your kids back to class.
Childhood immunization rates are important to help protect classrooms and communities from certain disease outbreaks. They're required for Missouri children to attend both private and public schools. But over the years, data shows immunization rates have been falling, not just here in Missouri, but nationwide, creating a greater risk for outbreaks of diseases like measles, which we've seen in Missouri this year, that were declared eliminated by the CDC almost 25 years ago.
This is definitely crunch time. Now is the time to check on their immunization status.
For Missouri students entering kindergarten, they'll need their DTaP, IPV polio, MMR, measles, mumps, rubella, hepatitis B, and varicella vaccinations. For students entering 8th grade, they'll also need Tdap and meningococcal vaccinations. The only way a student can be excused from getting these vaccinations is with a medical or religious exemption on file. While these are required for children to attend schools, data from the Department of Health and Senior Services shows immunization rates in both private and public schools continue to fall, which Dr. George Turapolitsi, who leads disease control and prevention efforts in Missouri, tells me can put herd immunity at risk.
Herd immunity means that you have enough people vaccinated in the community that the community is protected from outbreaks of infection.
According to DHSS, herd immunity for measles is achieved by 95% of a community being fully vaccinated with 2 doses of MMR. For the 2023-2024 school year, 19 mid-Missouri counties were under 95% MMR vaccination rates in kindergartners, while just the school year before, only 13 counties were under the herd immunity threshold.
We've seen a lot of infectious diseases that previously have been prevented and even thought to be eliminated have started to come back. The United States has already had more measles cases this year in only half of the year than in decades.
And the trend isn't just happening here in Missouri, it's a global phenomenon.
There is certainly some vaccine fatigue from multiple vaccinations needed during pandemic. Then there is also very strong misinformation, disinformation going on, which public health, we did not fight back well enough. And now it is so strong that the fighting that misinformation is not easy at all.
Vaccine hesitancy and more families choosing to use religious exemptions are also adding to the downward trend.
A lot of parents we see in research that those that are not anti-vax but vaccine hesitant is that they just are scared and they don't have the answers. So talking to their physician, their medical provider, is the best source of information that can kind of get rid of those hesitancies for them.
Morris and Turapolitsi agrees. If you have questions about vaccines, ask a health professional.
It's been our life's work to make sure we understand this, and we want to take care of you and your family. So asking those questions and reaching out right now is a great time.
And it's better to ask those questions now, rather than wait until an outbreak does happen in your town.
Do you need to really wait for that poor child to die before you decide to take seriously vaccination?
Now, in regards to misinformation, the Department of Health and Senior Services has a page that goes through those. I also asked Dr. Morris to break these down for me. You can find that on our website, abc17news.com.
All right, thank you, Gabrielle. If your child needs those back-to-school immunizations, here's a couple of options on where to go. Always go to your local public health department, federally qualified health centers, your pediatrician or family doctor. There's also the Vaccines for Children program that gives vaccinations at no cost to uninsured or underinsured children.